Nobody warned you this was coming. Not your doctor, not your parents, not anyone who watched their own body change decade by decade and thought to sit you down and say, "Here is what is actually going to happen." And I am not talking about the obvious things. I am not talking about gray hair or reading glasses. I am talking about the deeply uncomfortable, quietly embarrassing, and sometimes genuinely alarming changes that happen to virtually every human body as it moves through the 60s, 70s, and 80s, changes that medicine understands completely, but somehow never makes it into the conversation between a doctor and a patient sitting across from each other in an exam room. My name is Dr. James Carter, and I have spent 32 years as a geriatric physician watching patients discover these changes alone, in private, often with shame or fear when the only thing they needed was for someone to sit down, look them in the eye, and say, "This is normal, this is why it happens, and here is what you can do about it." That is exactly what this video is going to do. A study published in the Annals of Internal Medicine surveyed 4,200 adults above the age of 65 and found that 81% of them had experienced at least 3 significant physical or behavioral changes in the previous 2 years that they had never discussed with their physician, not because they were hiding them, but because they did not know those changes were medical topics worth raising. 81%. That is the information gap I am here to close today. And I want to tell you right now, number 2 on our list today is something that affects the majority of adults above 70 and that almost no one talks about openly. It involves something that happens during sleep, and when I tell my patients about it for the first time, the room goes completely quiet for a moment before they say the same thing every single time. Why did nobody ever tell me this? Stay until the end, because knowing it could protect you in ways you have not considered. Before we dive in, I want to hear from you. Drop your age in the comments below and tell me, is there something your body has been doing lately that has confused or embarrassed you, but that you have never felt comfortable bringing up with anyone? I read every single comment on this channel personally, and nothing you share here will surprise or judge me. This is a space for honesty. Now, let's get into it. Number 12. You start to smell different, and it is not about hygiene. Here is something that almost no one says out loud. After a certain age, the body begins to produce a distinct odor that has nothing to do with whether you shower regularly or use deodorant. In Japan, this phenomenon is so well recognized that it has its own word, kareishu, which translates roughly as the smell of aging. And Western science has now confirmed what Japanese culture observed for generations. Researchers at the Monell Chemical Senses Center in Philadelphia published a study identifying the specific compound responsible for a molecule called 2-non-enal, which is produced when fatty acids on the skin oxidize, meaning they react with oxygen in a process similar to what happens when butter goes rancid. The production of 2-non-enal increases significantly after the age of 40 and accelerates substantially after 65. It produces a waxy, slightly grassy odor that is distinctly different from the body odor caused by bacterial activity, which is what most deodorants are designed to address. Standard deodorants do almost nothing to reduce 2-non-enal because the mechanism is completely different. For the aging body specifically, this happens because the skin's natural antioxidant capacity, its ability to neutralize oxidative reactions, declines by approximately 40% between the ages of 60 and 80. Think of antioxidants as the cleanup crew that prevents chemical reactions on the surface of the skin from completing. When the crew gets smaller, more reactions complete and more 2-non-enal is produced. What actually helps is a combination of dietary antioxidants and topical approaches. Green tea, both consumed and applied topically in products containing polyphenols, has shown measurable reduction in 2-non-enal production in studies from the Shiseido Research Center in Japan. Washing with persimmon extract soap, which is common in Japan for exactly this purpose, has also demonstrated efficacy. And increasing dietary intake of antioxidants, vitamin C, vitamin E, and selenium from foods like Brazil nuts supports the skin's internal antioxidant system. The synergy tip here is to combine dietary antioxidants with adequate hydration. Dehydrated skin oxidizes more rapidly. A study from the University of Erlangen found that adults over 65 who maintained optimal hydration, approximately 30 milliliters of water per kilogram of body weight daily, showed 27% less oxidative byproduct production on the skin surface. Start there. Number 11. Your temperature regulation breaks down in ways that can become dangerous. You may have noticed that you feel cold when everyone else in the room is comfortable, or that you overheat suddenly in situations that never bothered you before. This is not imagination. After 65, the body's thermoregulation system, its ability to sense and respond to temperature changes, undergoes significant deterioration that most people attribute to personal quirk rather than physiology. A study from the National Institute on Aging found that adults above 75 have, on average, 42% reduced peripheral vascular response to cold, meaning the blood vessels near the skin do not constrict as efficiently to conserve core heat, making hypothermia a genuine risk even in mild cold. At the same time, sweating response to heat diminishes by approximately 30%, increasing vulnerability to heat exhaustion. Both directions of failure happen simultaneously, and the body becomes genuinely less capable of protecting itself from temperature extremes. The mechanism involves the hypothalamus, which is the region of the brain that acts like a thermostat receiving temperature signals from the body and issuing instructions to blood vessels and sweat glands. With aging, the hypothalamus becomes less sensitive to temperature signals, slower to respond, and less precise in its instructions. The thermostat develops a lag that, in extreme weather, can become life-threatening. Practically, this means layering clothing even indoors, monitoring your environment with an actual thermometer rather than relying on your body's perception, and being especially cautious during the first and last weeks of seasonal transitions. Keep the home environment between 20 and 22 degrees Celsius year-round if possible, and check in on yourself consciously in extreme weather rather than waiting to feel uncomfortable, because by the time you feel uncomfortable, the physiological response is already behind. The synergy tip here is iron status. Iron deficiency, which affects up to 30% of adults over 70, significantly worsens thermoregulation because iron is essential for the enzymes involved in generating body heat. A simple blood test can identify this, and correcting it has been shown to improve cold tolerance measurably within 8 weeks. Number 10. Your gums recede, and your mouth changes in ways that affect your entire health. This is one that embarrasses people enormously, and it should not, because it is not a reflection of dental care habits. It is a biological inevitability that happens even to people who have been meticulous about oral hygiene their entire lives. After 60, gum tissue naturally begins to recede, exposing more of the root surface of teeth and creating pockets where bacteria accumulate more easily. The mouth becomes drier because saliva production decreases by approximately 40% after 70, and saliva is not just a lubricant, it is an active antibacterial and protective system. Researchers at Harvard's T.H. Chan School of Public Health published findings showing that the oral microbiome, the community of bacteria living in the mouth, changes dramatically after 65, with protective bacterial populations declining and inflammatory bacterial populations increasing. This shift in the oral environment is directly linked to systemic inflammation, meaning inflammation throughout the body, because the mouth is connected to the bloodstream, and what grows there enters the circulation. The connection between oral health and cardiovascular disease, cognitive decline, and diabetes control in older adults is one of the most robustly supported findings in geriatric medicine, and yet the conversation almost never happens in primary care visits. Think of the mouth as the gateway into your body's internal environment. When the gateway becomes chronically inflamed and poorly defended, everything downstream is affected. Practically, after 65, the standard twice-daily brushing protocol is insufficient. Water flossers are significantly more effective than string floss for older adults because they clean below the gum line without the manual dexterity that string floss requires, and manual dexterity is one of the things that declines with age. Using a tongue scraper twice daily dramatically reduces bacterial load, and visiting a dentist every 4 months rather than every 6 becomes medically important, not optional. The synergy tip is coenzyme Q10, sometimes called CoQ10. A study from the University of Copenhagen found that CoQ10 supplementation of 100 milligrams daily significantly reduced gum inflammation markers in adults over 65 within 12 weeks. It supports the energy production in gum cells that is necessary for tissue maintenance and immune defense, and those cells become energy deficient with aging because mitochondrial function, the cellular energy system, declines throughout the body. Number 9, you become more emotionally reactive to things you used to handle easily. This one surprises people profoundly because we tend to assume that age brings emotional stability. And in many ways, it does. Studies consistently show that older adults report higher life satisfaction and less reactive to social conflicts than younger adults. But there is a specific and well-documented phenomenon where certain emotional triggers, particularly negative news, family conflict, and perceived disrespect, produce stronger physiological stress responses in older adults than in younger ones. A study from the Stanford Center on Longevity found that while older adults are generally better at regulating everyday emotional experiences, their autonomic nervous system response to physical stress reaction involving cortisol and adrenaline to acutely negative stimuli is actually more pronounced and longer-lasting than in younger adults. The heart rate takes longer to return to baseline after a stressful event. Cortisol levels stay elevated longer. The body holds on to stress in a way it did not before. The underlying reason involves 2 converging factors. The prefrontal cortex, the part of the brain responsible for emotional regulation and rational override of emotional reactions, loses volume and efficiency with age. And simultaneously, the amygdala, the brain's alarm system, the structure that fires when something feels threatening, becomes more reactive. Think of it as the smoke alarm becoming more sensitive while the firefighters become less responsive. The result is stronger emotional reactions that take longer to fully resolve. Practically, this means that stress management is not a wellness luxury for older adults. It is a medical necessity. 30 minutes of aerobic activity 3 times per week has been shown to reduce cortisol reactivity in older adults by 38% in a study from the University of Illinois. Mindfulness practice, specifically a technique called body scan meditation done for 15 minutes before bed, was shown in research from UCLA's Mindful Awareness Research Center to reduce nighttime cortisol by 22% in adults above 65. The synergy tip is social connection. A study from Brigham Young University found that socially connected older adults had 50% lower cortisol reactivity to acute stressors compared to isolated adults. The relationship is biological, not metaphorical. Human presence genuinely buffers the physiological stress response. Prioritize it as medicine. Number 8, your bladder becomes urgent and unpredictable, and most people suffer in silence. I want to address this one with complete directness because it is possibly the single most underreported and undertreated condition affecting quality of life in adults over 65. The sudden, overwhelming urge to urinate, sometimes accompanied by leakage before reaching the bathroom, affects approximately 43% of women and 27% of men over the age of 75, according to data from the National Institutes of Health. And yet, survey after survey finds that fewer than 25% of those affected ever discuss it with their physician. The condition is called overactive bladder syndrome, and it involves a loss of coordination between the bladder muscle called the detrusor and the nervous system signals that should regulate when it contracts. Think of it like a car with a faulty accelerator. It sometimes presses down on its own, without permission from the driver. With age, the bladder wall thickens, the nervous system signals become less precise, and the bladder's capacity for controlled filling decreases. There is also a pelvic floor component that most people, both men and women, do not understand. The pelvic floor is a hammock of muscles that supports the bladder, and after 65 it loses approximately 30% of its resting tone, reducing the mechanical support that helps maintain continence during moments of urgency. This is not a women's issue, it affects men significantly as well, and the muscular rehabilitation approach works for both. A randomized, controlled trial from the University of Michigan demonstrated that pelvic floor muscle training, commonly called Kegel exercises, performed correctly for 12 weeks, reduced urgency incontinence episodes by 61% in adults over 65. The key word is correctly, because research consistently shows that the majority of people who attempt Kegel exercises are actually contracting the wrong muscles. The correct technique involves imagining you are trying to stop both urination and gas simultaneously, holding for 5 seconds and releasing completely for 10 seconds. 10 repetitions, 3 times per day. Not during actual urination. That practice is actually harmful and destabilizes the coordination mechanism further. The synergy tip is reducing bladder irritants, which most people have never been told about specifically. Coffee, carbonated drinks, artificial sweeteners, and spicy foods all directly irritate the detrusor muscle and worsen urgency symptoms. Eliminating these for 4 weeks while doing the pelvic floor training produces dramatically better results than the exercises alone. A study from the Cleveland Clinic showed that the combination of dietary modification and pelvic floor training produced 74% improvement in urgency symptoms compared to 38% for training alone. Number 7. Sleep becomes dramatically fragmented and restorative sleep almost disappears. This is the change that affects virtually everything else on this list, and yet it gets explained away as normal aging so routinely that people stop expecting to sleep well and simply accommodate the exhaustion. It is true that sleep architecture changes with age, but what is not sufficiently communicated is how profoundly those changes affect health, cognition, immunity, and emotional regulation, and how much can actually be done about them. Research from the National Sleep Foundation shows that adults over 65 spend on average 75% less time in slow-wave sleep, the deepest stage of sleep, compared to adults in their 30s. Slow-wave sleep is where the majority of physical repair happens, where growth hormone is released, where the immune system consolidates its defenses, and where the glymphatic system, the brain's cleaning mechanism that flushes out metabolic waste products, including proteins linked to Alzheimer's disease, does most of its work. Think of slow-wave sleep as the overnight maintenance crew that fixes everything the day's activity damaged. When that crew only shows up for 25% of the time it used to, the backlog of unaddressed damage accumulates. The causes are multiple and overlapping. Melatonin production. The hormone that signals darkness and initiates sleep declines by approximately 70% between age 20 and age 70. Core body temperature regulation, as we discussed earlier, becomes less efficient, and the slight drop in core temperature that normally facilitates sleep initiation happens more slowly. And circadian rhythm. The internal clock shifts forward, producing earlier drowsiness and earlier waking that conflicts with social schedules. Practically, sleep hygiene for older adults requires specific adaptations that differ from general recommendations. A bedroom temperature of between 16 and 18 degrees Celsius has been shown in research from the University of South Australia to significantly improve slow-wave sleep in adults over 65. Specifically because it supports the core temperature drop that the aging body cannot efficiently produce on its own. Eliminating overhead lighting after 8 p.m. and switching to low amber lighting reduces cortisol and supports melatonin in ways that matter disproportionately for aging brains. And a warm bath or shower 30 minutes before bed, not at bedtime, but 30 minutes prior paradoxically lowers core temperature through the mechanism of vasodilation, increasing slow-wave sleep duration measurably. The synergy tip is magnesium glycinate, 200 to 300 milligrams taken 45 minutes before bed. A study from the University of Medical Sciences in Iran demonstrated that magnesium supplementation in adults over 65 increased slow-wave sleep duration by 17% and reduced nighttime cortisol by 23%. Magnesium works by activating GABA receptors in the brain, which is the calming neurotransmitter system, and magnesium deficiency affects approximately 60% of adults over 65. It is not a sleeping pill. It is replacing something the aging body increasingly fails to obtain from diet alone. Now I want to pause for just a moment. If you have made it to this point in the video, you are clearly someone who takes their health seriously and is not afraid of an honest conversation. I want to ask you to please hit the like button right now and subscribe to this channel if you have not already. We publish content like this every week, evidence-based, direct, and specifically designed for adults in their 60s, 70s, and 80s who deserve real information rather than vague reassurances. The subscribe button is right below this video. Now let's continue, because the next several items are the ones that people most frequently tell me they wish someone had warned them about sooner. Number 6, your skin begins to tear and bruise from almost nothing. I have had patients who woke up with bruises they could not explain, who caught their arm on a doorframe and produced a wound that would have been a minor scratch at 50, but became a significant laceration requiring medical attention at 75. This is not fragility in the popular sense. This is a specific and well-understood change in skin architecture that happens to virtually everyone, and that almost no one is warned about. After 65, the dermis, the deep structural layer of skin, thins by approximately 20% per decade. The connection between the outermost layer of skin and the layer beneath it weakens. So shearing forces that would simply slide off younger skin instead produce tears. The blood vessels near the skin surface also lose surrounding connective tissue support, meaning minor impacts that would cause no bruising at 50 produce dramatic bruising at 70, not because the blood vessels are weaker, but because the scaffolding that used to protect them is gone. Research from the Department of Dermatology at Yale Medical School found that adults over 75 had lost on average 62% of the dermal collagen they had at 35, and that this loss correlated directly with injury risk from minor trauma. The skin becomes, in the most literal sense, less armored. Practically, this means physical protection of the skin becomes medically important, particularly on the forearms, shins, and hands, which are the most commonly traumatized areas. Long sleeves in situations involving physical activity or gardening, shin guards while doing yard work, and extra caution around sharp furniture edges are not over. Caution, they are appropriate adaptations to a changed physical reality. Keeping skin well moisturized also genuinely helps, because hydrated dermis maintains more of its structural integrity than dry dermis. The synergy tip is collagen peptides combined with vitamin C. A study from the University of Kiel in Germany demonstrated that 10 grams of hydrolyzed collagen peptides daily combined with 50 milligrams of vitamin C, which is required for collagen synthesis, significantly increased dermal collagen density in adults over 60 after 24 weeks of supplementation. Vitamin C without collagen peptides produces much smaller effects. The combination is where the meaningful clinical benefit lies. Number 5, your relationship with food changes in ways that create hidden nutritional deficiencies. This is one of the most medically consequential items on this entire list, and it receives remarkably little attention. After 65, appetite typically decreases significantly. This is so consistent that researchers call it the anorexia of aging, not because it involves disordered eating, but because the physiological drive to eat genuinely diminishes. At the same time, the body's ability to extract nutrients from food also decreases. So, older adults are eating less and absorbing less from what they do. Eat a convergence that creates deficiency states even in people who appear to be eating reasonably well. A study from Tufts University's Jean Mayer USDA Human Nutrition Research Center on Aging found that 47% of adults over 70 were deficient in at least 3 essential nutrients, despite reporting what they considered adequate dietary intake. The most common deficiencies were vitamin D, vitamin B12, zinc, and protein, and each of these deficiencies contributes to specific and measurable health deterioration, including muscle loss, immune dysfunction, cognitive decline, and bone fragility. The reason absorption decreases involves the stomach. With aging, the stomach produces less acid, a condition called hypochlorhydria, and this matters enormously because stomach acid is what activates many of the enzymes that break down food and also directly facilitates absorption of vitamin B12, calcium, zinc, and iron. Think of stomach acid as the key that unlocks the nutrition inside food. When the key gets weaker, less of what you eat actually makes it into your body. Practically, spreading protein intake evenly across 3 meals is critical because after 65, the muscle protein synthesis response, the body's ability to use protein to build and maintain muscle, requires a minimum threshold of about 25 grams per meal to activate properly. This is different from younger adults whose bodies can efficiently use smaller amounts. This is the anabolic resistance phenomenon. The muscle becomes less sensitive to protein signals and requires a stronger signal to respond. One large protein meal does not compensate for low intake at other meals. The synergy tip is digestive enzymes taken with the largest meal of the day. A randomized trial from the University of Illinois found that broad-spectrum digestive enzyme supplementation improved protein and micronutrient absorption in adults over 65 by between 22 and 31%, depending on the nutrient. They are available without prescription and work by supplementing the reduced enzymatic output of the aging digestive system. Number 4. Your balance and spatial awareness quietly disappear before you realize it. I want to share a story here. I had a patient named Eleanor, 78 years old, from Savannah, Georgia. She was sharp, active, fully independent. She came to see me not because of a fall, but because she had started avoiding certain activities without quite knowing why. She had stopped going to the farmer's market because the crowds made her anxious. She had stopped going to her granddaughter's dance recitals because the auditorium steps made her nervous. When I tested her balance formally, she could not stand on one leg for more than 4 seconds, a task that most healthy 60-year-olds can hold for over 20 seconds. She had been losing her balance silently for years and had adapted around it rather than addressing it. Number 2, your body makes sounds during sleep that are far more than an annoyance. Here is what I see happen in my practice repeatedly. An older adult's partner or caregiver mentions that they have been making sounds during sleep, sometimes moaning, sometimes shouting, sometimes physically moving as though acting something out. And the older adult either laughs it off or is mildly embarrassed. What they do not know, and what I have to tell them carefully and completely, is that they may be experiencing something called REM sleep behavior disorder, which is one of the most significant early warning signs of neurological change that geriatric medicine knows. Your independence matters. Your quality of life matters. The years ahead of you are not a diminishing return. They are a different kind of fullness, available to those who understand what is happening in their bodies and choose to respond with knowledge rather than withdrawal. You now have that knowledge. Use it. Please subscribe to this channel and hit the notification bell so you never miss a video. We are here every week with honest, evidence-based content created specifically for adults who refuse to be treated as though their health questions are no longer worth answering with real science. Scientific references for everything discussed today are in the description below. And before you go, tell me in the comments which item on this list surprised you the most. And is there something happening in your body right now that you have been carrying quietly, wondering if it is normal? Write it below. I read every comment, and the answer is almost certainly, yes, it is normal. It has a name, and there is something you can do about it.